right, good morning. I'm Nicole Bootsman, and I looked at post-operative orthopedic opioid prescribing for patients who are opioid naive. Opioid overprescribing after elective surgery can lead to chronic opioid use, and studies have shown that around 80% of patients who used heroin reported an introduction to opioids via prescription. Up to 80% of opioids remain unused after elective surgery, leading to potential diversion and misuse. Patients who are opioid naive should require no more than 60 opioid-containing tablets on discharge from total knee arthroplasty to manage post-surgical pain while reducing opioid-related risks. In analyzing drug claim data, I determined that 50% of patients who are opioid naive post-total knee replacement received greater than 60 opioid-containing tablets in some Saskatchewan centers. I further looked at a time comparison to assess whether a Canadian consensus publication in the Canadian Journal of Pain specifying quantity restrictions resulted in changed prescribing, which did not appear to be the case. In surveying Saskatchewan physicians as a whole, patient over-reliance on post-surgical opioids is problematic, as only 32% of physicians self-reported either very or extremely confident in planning or carrying out opioid deprescribing. As a result of the data analytics, my aim statement is to reduce the number of opioid-naive patients post-total knee arthroplasty prescribed greater than or equal to 60 opioid-containing tablets by Regina orthopedic surgeons by 25%. After looking at the primary drivers, and in order to get physician buy-in, I surveyed orthopedic surgeons to determine what would assist them to optimally prescribe to patients who are opioid naive. The survey results indicated a preference for a presentation on optimal prescribing. However, the time frame for my intervention had to be extended because our orthopedic colleagues are playing a bit of catch up right now. Hopefully the fall will bring more promise for project completion and further evaluation given the background findings. Thank you to QIck for some of my major learnings, including finding a champion, which is particularly important when implementing change for a group in a different profession, as well as essential to engage with those who are implementing the changes to ensure buy-in. And although we know that change is difficult, the pandemic seems to have reinforced this on a whole new level. So we need to continue to work together to incorporate evidence-based practices.